Good afternoon, my friends. The doctor is in the house. All right, welcome back to another episode of To Your Health with Dr. G. I'm Dr. G, Dr. Mark Gomez, board certified internist out of Edward Hospital in Naperville, Illinois. So welcome back, everyone. Today we're going to continue our summer countdown series. That's right, everyone, we're counting down to summer. Today we're going to talk about asthma and allergy. This is going to be a great topic. And the reality is that there are so many people that suffer from asthma and allergy, and that this is very relevant because we're getting outside right now, we're going to enjoy the weather, but most importantly, we're going to be enjoying our family, our friends, and our loved ones. So, again, my name is Dr. Mark Gomez. Welcome back to the show. For those out there that are new to the show, each week I invite a group of my esteemed colleagues, and we talk about a different topic. Today happens to be asthma and allergy. For those of us that are out there, this topic is going to be very pertinent. We also want to thank the listeners out there and the people that are watching us on Facebook Live. And again, without your guys' support, none of this would be possible. So again, my name is Dr. Mark Gomez. You can check me out on Facebook Live. Follow me on Instagram and Twitter at ToYourHealthDrG. Also check me out on my website at www.drmarkgomez.com. Today's episode, Asthma and Allergy, is brought to you by our platinum sponsor, Midwest Sports Medicine. Check them out at www.gomidwestsports.com. So before I introduce my esteemed panel today and get into some great asthma and allergy discussion, I do want to hit you guys with a quick disclaimer, as usual. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So thanks everybody for coming in today. Again, this is our second episode in our Countdown to Summer series. We're bringing it to you guys live and direct and really talking about a concept today, a series of conditions, asthma and allergy, which are certainly quite common this time of year, certainly what I see as a primary care physician. And again, I can't wait to introduce my esteemed guests to you guys. So before we get into that, I just want to give people a couple quick updates on things, because when we talk about asthma and allergy, this is real stuff. These are conditions that affect a lot of people. As a matter of fact, millions and millions of Americans suffer from asthma and or allergies. So we're going to break this down today. So what I want to do is I want to introduce my guests. And again, thanks everybody for listening. So my first guest today, Dr. Juanita Mora from the Chicago Allergy Center. I recently connected with Dr. Mora through the American Lung Association. So we want to certainly thank those guys for connecting us. And I'm so excited to welcome Dr. Mora to the show. Dr. Mora is a double board certified internist and pediatrician, as well as board certified in allergy and immunology. You can check her out at www.thechicagoallergycenter.com. Dr. Mora, welcome to the show. And why don't you just start by just telling us who you are, where you did your training from, and kind of what asthma and allergy mean to you.
Oh, sounds great. Hola to everyone listening today. I'm born and raised in Chicago, a Pilsen girl, so love to give a shout out always to the Pilsen community. But I did my training all in Chicago, College University of Chicago, med school at UIC. I did internal medicine and pediatrics residency at Rush University Medical Center, followed by allergy and immunology fellowship also at Rush. I was in a private practice for 5 years and went off on my own for the last 3.5 years. And asthma is one of the passions that I truly have. I love going into the community, talking about it, doing intervention. And along with the American Lung Association as one of the national spokesperson this year, I'm going to drive it as my passion to work with especially inner city kids, inner city adults, and talk about asthma, how we can do intervention, and what we can as a doctor community as well too do for them, and get pharma involved, get community actual organizations involved. So I'm really happy to be here. Thank you for the invitation, and really, really humbled with a wonderful panel here today.
Excellent. I love how we're going to get everybody involved, because that's what it comes down to. It takes a village, and this is certainly a public health burden. As a matter of fact, billions upon billions of dollars each year are spent on healthcare regarding asthma and allergy. So this is certainly has an economic impact. And then when you look at a global impact, the number just becomes astronomical. My second guest today, Dr. Stephen Kraseman, he and I go back a long time. Actually, we used to kind of pass each other in the hallways at Loyola but a long time ago. And I've got a couple. I've got another. My third guest is a Loyola grad as well too. But Dr. Kraseman and I connected a long time ago, and he's been a good friend, and he's taken a lot of care of my patients over the years. Dr. Kraseman is a board-certified otolaryngologist, and that's always a hard word to say, but we'll just call it an ENT doctor. But a board-certified ENT physician and surgeon with the group Drs. Gerges and Associates. You can check him out at www.gergesent.com. That's GIRGISENT.com. Dr. Stephen Kraseman, welcome to the show. Thanks for coming out today, and tell us a little bit about your background, where you trained, and a little bit on your initial thoughts maybe on asthma and allergy.
Thanks for having me, Dr. Gomez. Happy to be here. So I grew up in the western suburbs of Chicago in Naperville, and as you mentioned, did my medical training at Loyola University in Maywood. Did pass you quite a few times in the hall, and from there I ended up doing my ENT head and neck surgery training out in Pennsylvania with the Geisinger Medical Center. And I've been back in the Chicago area in private practice since 2011, the past year of which has been at Drs. Gerges and Associates, as you mentioned, which is a full-service general ENT practice serving both children and adults of all ages. And a large portion of our collective practice at Drs. Gerges and Associates is allergy and sinus, both treating those conditions from a medical standpoint, but also from a surgical standpoint as well. I'm passionate about patient education and public outreach for health matters. I feel that if people are more educated about their bodies and their functions, that collectively we'll have better health outcomes. And so, you know, I feel that shows like this to educate patients really help the overall healthcare of our country at kind of a grassroots level. So I'm really happy to be here and honored to be amongst such talented professionals.
Thanks, Dr. Kraseman. Yeah, and we're talking about moving the needle, and this is one of the reasons why I kind of got into the show and wanted to come with this idea of To Your Health with Dr. G, is really to empower the consumers that are out there, to give them better opportunity to bring everybody to the table, to have equity and access as we all try to strive for healthier and more fulfilling lives. My last guest today, Dr. Matthew Baugh, he and I go way back to our days at Loyola as well too. So I got a couple of Stritch graduates out here today, myself included, of course. Dr. Baugh, I used to see him all the time in medical school, and then followed him through residency. I think I kind of followed you all the way through. And Dr. Baugh was when I was a senior resident, my third year, Dr. Baugh was one of our chief residents in the internal medicine program at Loyola. And so now the tide's turned a little bit. He used to ask me questions and kind of pimp me out during rounds. Now I get to ask the questions today because it's my show. All right, I love it.
Great.
So thank you, Dr. Baugh. Let me just give a quick announcement on Dr. Baugh. He's a board-certified pulmonary and critical care medicine physician with DuPage Medical Group. You can check him out at www.dupagemedicalgroup.com. Thank you, Dr. Baugh. Welcome to the show. Tell us a little bit about your background, maybe some of your interests in asthma and allergy. Thanks.
Yeah, thanks so much for having me. It's great to be on the show with you guys today. And as you said, Mark and I go way back. I did my decade at Loyola, like we were just talking before the show. I did my medical school residency, chief residency, and then fellowship in pulmonary medicine at Loyola. And I joined DuPage Medical Group right out after fellowships. I've been out here in the western suburbs for about 7 years. And yeah, asthma is one of my interests in pulmonary medicine. I think it's a really interesting disease that we have a real opportunity to educate patients and to make a real difference in people's lives. And it's a great topic for this time of year. So again, really happy to be here.
Excellent. So for those that are new to the show and those that have been found the show, before we kind of get into our discussion, I always like to come up with something called the chief complaint. And being part of a group of physicians on the panel, they would they will understand that going back to our first years in medical school, and the chief complaint for those out there that don't know what that means, it means when somebody comes into your office or comes into the clinical setting, why are they there? And so when we shape the discussion on healthcare and things on this show, we always say the chief complaint, and this is more like what is the question or the situation of the hour. So our chief complaint today on asthma and allergy is how do we best minimize asthma and allergy burden during the summertime months? So what I want to do first is I'm going to actually ask the first question to Dr. Mora. And Dr. Mora, can you just kind of break down what is asthma and what is allergy for those that are out there?
Oh, sure, of course. So asthma is a reversible obstructive disease, and it presents, actually 50% of asthma presents in childhood, and there's 50% that's adult onset asthma as well too. Symptoms that people manifest is a chronic cough that won't go away, wheezing, sometimes in spring and fall, sometimes with colds, and basically having recurrent bronchitis, as they call it, when it's truly asthma, or having recurrent shortness of breath and wheezing. They can't exercise. They can't do a lot of their functions. When we talk about allergy, allergy is the immune actual reaction to an allergen that can be food, it can be a cat, a dog, dust mites, and it usually is IgE mediated, which means it manifests with hives. Lip swelling, eye swelling, sometimes vomiting, diarrhea when it's an allergic reaction. When it's just environmental allergens, it might just be a runny nose, postnasal drip, nasal congestion, recurrent sinusitis, recurrent nasal polyposis that sometimes manifests in our allergic patients as well too.
Excellent. I just love talking about this. It's certainly on the sorry, not on the asthma side, but on the allergy side, me being a lifelong perennial allergy sufferer. I hate to admit it right in front of the allergist, but something that's certainly come home to me. And for those that don't know me, growing up, my twin brother had a significant history of asthma growing up, and went through a number of asthma attacks that made it really quite personal, and having an identical twin, and that was one of my catalysts for going into medicine. I haven't seen him suffer from some pretty dangerous asthma attacks, and then now I'm here today, and my brother's fine, by the way. He's local. But it's true. Asthma is certainly a disease of the airways. When those airways, as you said, the airways become blocked and they become narrowed, and it can result in difficulty breathing and a whole host of other symptoms. And the reality is that that asthma is such a big burden in this country. I've got some stats I want to hit you with real quick. More than 21 million Americans, based on the most recent data reported by CDC, have asthma, and in children, well over 6 million American children in this country having asthma, and asthma is the most common chronic disease condition of children under the age of 18. Like, wow. And interesting thing, the state with the highest prevalence of asthma is California, but you have to think about California being a very populous state. And then the lowest state with prevalence, Wyoming, based on the CDC data. So, Dr. Kraseman, give us a sense of, as an ear, nose, and throat physician, what's kind of the basic presentation that you might see of asthma or allergies? Either way you want to talk about allergies, maybe you see that much more common, but what's the kind of clinical situation you see? Somebody may come into the office, what are they kind of complaining of, or some of their symptoms at the time, and you make that diagnosis of asthma or allergy?
Well, a lot of the ENT-related allergy-type symptoms that we see, especially this time of year, tend to be nasal obstruction, difficulty breathing through the nose, a runny nose. Tends to be clear drainage out of the nose, so people that are blowing their nose all the time, wiping their nose frequently. Postnasal drainage, which is that sensation of things dripping from the nose down the back, sneezing, itchy, watery eyes, and facial pain and pressure are kind of the typical ones. Along with that, nasal congestion or stuffy nose can also go diminished sense of smell and taste too. So those are the common symptoms we see folks with in the ENT clinic. A lot of those symptoms can be mistaken for sinus infections or other issues and may go undiagnosed. Some of the throat manifestations can be scratchy throat, sore throat, hoarse voice for a number of reasons. So, we'll see people in for a lot of those type of symptoms, and there's a lot of overlap in our patients in the ENT world that have chronic sinus disease, which means persistent inflammation of the sinus lining, and also have airborne allergens. In fact, it's it's about a 50% overlap or so. So it's always something that's on our radar when folks are coming in with nasal complaints, especially this time of year when allergens are so prevalent. So those are the types of things we see with our patients.
Excellent. It's interesting, as a primary care physician, certainly we are kind of on that front line, and some of the things that we see right away are people come in with those exact symptoms. And a lot of times I see people, they come in and they say, hey, Dr. G, I think I got a sinus infection, and literally want to go right to an antibiotic, and literally within the first day, not even 24 hours of having symptoms, and they say, I know it's a sinus infection, I don't want to come and see the doctor, can you just call me an antibiotic? Dr. Baugh, is that kind of an appropriate approach? I know from a lung perspective, a pulmonologist perspective, that's probably not the appropriate approach, especially when sometimes the symptoms may actually just be allergies, not necessarily an infection.
Yeah, one of the common complaints that we will see patients for is chronic cough, and a lot of people realize that one of the top causes of chronic cough is postnasal drip. One of the others is asthma, but yeah, people come in and they may have allergies or they may have a cold, and a lot of people want an antibiotic, but an antibiotic may not be the right thing for them. And exactly as you mentioned, if it's symptoms that just started within 24 hours, it's unlikely that that's going to be something that's going to benefit from an antibiotic, especially if it's viral or again, maybe not even infectious. It could be just due to allergies. But cough can be a very distressing symptom, so patients are just looking for something they want to feel better, which is completely understandable.
Excellent. Dr. Mora, how do you tell the difference sometimes? I get asked that question quite a bit. How do you tell the difference between like a cold and allergy?
A very good question. So I get that question all the time too. So cold, you have to think of actual systemic symptoms. So they're going to feel fatigue, a decreased appetite. It might come with fever. It's, the color rhinorrhea might be both in allergies, and it can also be in a non-allergic rhinitis as well, or just a cold. But when it comes to a cold to actual allergy symptoms, you're going to think the actual runny nose that's nice and clear. They feel really good otherwise, but that just congestion is just horrible. It's usually when they go outside versus being indoors. As soon as they turn on the AC, suddenly their runny nose gets so much better. They take a little antihistamine, and all the symptoms suddenly resolve.
Excellent. Well, it's interesting because I'll see some other cases where people say, Dr. G, I swear I've got green nasal discharge. I'm pretty sure it's an infection. When Dr. Kraseman, when you get that question asked to you and somebody might come in literally with less than a day of symptoms or maybe 2 days of symptoms, is it always an infection with green nasal discharge?
It's a good question, and the answer is no. There used to be a lot of stock placed, even among healthcare providers, in the color of the stuff coming out of the nose or down the back of the throat. And to a large extent, a lot of that has been debunked with good scientific studies. So typically with allergies, we see the stuff coming out of the nose clear. However, it's possible for it to be discolored. So, as you were saying, a lot of the surrounding circumstances and additional symptoms have to be considered when trying to figure out, is this a bacterial sinus infection or a cold versus an allergic reaction, and response to treatment sometimes. Sometimes it's unclear, and if the symptoms improve after 24, 48 hours of an antihistamine, well, then that's probably suggestive of allergies more so than infection.
Excellent. As we're keeping this theme going on in the summertime, and as some of my colleagues already have said, we're getting outside now, we're trying to enjoy our family, our friends, our loved ones, we're barbecuing a little bit, we're playing sports. This is kind of like the right time to have those outdoor allergens really kind of trigger things. Dr. Baugh, when you see patients that have asthma, and it's this time of year, are you seeing more cases now? Does it matter whether it's summertime or wintertime? Are you seeing some more asthma exacerbations coming through this time of year?
Yeah, we definitely see changes in patient symptoms depending on changes in the weather, and it may just be either the temperature or humidity levels, or just the fact that they're outside, there's allergens in the air, they're exposed to mold and pollen, and so we will definitely see variations in patient symptoms, and especially in the summer months, we start seeing some of our asthmatics have more trouble.
There's an interesting thing, an interesting journal that was, interesting article that was published by the in the Annals of American Thoracic Service, the Annals of the American Thoracic Society. Say that really fast. Published on January 12th of this year. They talked about some of the economic impact of asthma in particular, and they estimated on that date $80 billion annually in medical expenses, missed work, what we call absenteeism, less productivity, presenteeism, as we call it, and school days and deaths. And it's interesting, they actually broke it down to how much the cost is per person. And I thought this statistic was very interesting. They estimated at $3,000, more than $3,000, an annual cost per person for the medical costs of asthma management. And a lot of it being prescription drugs, but certainly office visits, hospital, ER trips or immediate care trips. And what I want to tell people that are out there that have asthma or allergy is that you can live a healthy and active life too. Just because you have a condition doesn't mean that you can't live to the fullest. And the reality is that, yes, asthma, there's no cure for asthma, but if you properly manage it, you can do so much better. So Dr. Mora, what's your things? What are the kind of messages you tell patients on how to properly manage it so they can live an active and healthy life?
So this is a conversation I have in the office with every asthmatic that comes into the office. I tell them, my job is for you to have an improved quality of life. I want you to be able to do all the sports that you want. I want you to be able to travel. I want you to not miss your son's graduation because it's outdoors. I want to actually have you live a normal life with asthma under good control. So I said, asthma cannot be cured, but it can be controlled. And this is where we're going to work in a partnership. We're going to talk about medications, inhaler technique, the newest and greatest medications that are out there now to treat asthma as well too. And then, like you said, it takes a community. So in my pediatric patients through the American Lung Association, I refer a lot of my little patients, my pediatric patients who have asthma, for pediatric home assessment, where they do allergen actual, they figure out if the parents smoke, do they have a cat or a dog, where the cat or the dog sleeps, because it's never in their bedroom, of course.
Oh, yes,
And they actually go ahead and, further teach more than in the office. Obviously, they go and do interventions. They give them dust mite covers. They might help with drywall replacement as well too. So we're going to work a lot on a project to get more referrals into the American Lung Association to get more kids with asthma under good control.
Excellent. Let's talk about that a little bit, because it was interesting. As I was doing some prep for the show, I was coming across, again, sometimes at the end of the day, we want people to have equity, we want them to have access. And yes, there's some newer medicines that are out there, but the medicines might not be affordable for a lot of people. And as clinicians, we have to even try even harder to try to align some resources so those people don't end up in the ER, or they don't keep seeing you. For example, like Dr. Baugh in your practice, you're not seeing an asthma exacerbation. It's the same person, 3 times a month, and they're using a rescue inhaler like crazy. That's not a win-win situation for anybody, and only driving up some of the costs and missed work opportunities, missed school opportunities. So, how do we kind of get to that? And essentially, I was talking to my wife about this the other day, and we were talking about, well, for example, in some of the underserved areas or inner cities where they have these exposures, a lot of dust mites, certainly cockroaches. And my wife was disgusted by that, by the way. I was like, yeah, there's such a thing as cockroach allergy. She's like, what? And I go, no, it's true. It's very true. But whose responsibility does it come down to? In the cockroach situation, is it the tenant of the building that they live in, or is it the owner of the building? So we got into these kind of this crazy discussion on who it is. But the reality is that people are still having risk and they're still presenting with symptoms. So Dr. Baugh, let me ask you this: what are some of the kind of basic medicines, maybe you can help our viewers out there and our listeners, just kind of in basic terms, like what are some of the basic medicines in asthma? How would you kind of describe them, the concept of controller medicine, preventative medicine versus like rescue inhalers, quick relief kind of stuff? How would you kind of break that down?
Yeah, so just as you mentioned, we consider kind of categories of the quick reliever medications or emergency inhalers versus controller medications. So the emergency medications are medications that they use when they need it. They work quickly, and that generally is a medication like albuterol. And those are medications that work within minutes, but they don't last very long. They last, several hours or so. But those are medications to be used really when needed. But in patients who are needing to use their rescue inhaler more frequently, then we start to look at some of the controller medications, and that's where inhaled corticosteroids are some of the mainstay of treatments for patients with asthma. And then depending on the severity of asthma, then we may start being more aggressive with higher doses or a combination of medications to keep their symptoms under control. Because just as Dr. Nor mentioned, you know, we want these patients to be functional. We want to keep them out of the emergency room. We want to keep them out of the hospital, and teaching them proper use of their medications and making sure they have access to medications is so critical in keeping them under control.
Excellent. There was a statistic that I came across which I found which is shocking. But when you look at the asthma, kind of the mortality, because the reality is that people do still die. And it's just disheartening when you think of something that can be so properly managed, and there may be some gaps in the equity of things. But I came across this statistic that 14 people in the USA die each day from asthma, and that equates to over 5,000 people each year. And I just thought that was just an awful statistic, and it just kind of tells me we have to do better. Dr. Mora, when you hear that kind of statistic, you know, how do you interpret that?
Well, it saddens me, and it also drives us, I think, as a whole team to try to improve that statistics, because in the last 10 years, we have had no improvement in the morbidity and mortality of asthma. And when we look at what group has the highest risk of mortality, teenagers. And the reason for these teenagers is because they ignore their symptoms. They are short of breath and wheezy, and they decide they're going to go to bed and sleep it off. They don't take their medications. And so that is one population that we really, really want to do a better approach with, and a better intervention as well too. Maybe get into some apps, or get Chance the Rapper, if he's hearing us today,
Come on, Chance. Listen to the Dr. G, baby. Come on.
to do an app where they encourage them to take their inhalers. And then they're the ones playing sports as well too, who unfortunately ignore their symptoms and also die on the football field, on the basketball field as well too.
That's just awful when you think about things that can be so preventative. But we have to do better as a society. This is a public health burden, and as we call ourselves to action and engagement, we can do much better. So I always talk about these partnerships, and on the show in the past, I've talked about the importance of relationships. There's a lot of stakeholders out there when we talk about health, whether it's asthma, allergies, heart disease, cancer. We got a lot of people that are trying to do some really, really good things. And I always tell people it starts out by making sure you're doing well. It starts out as a primary care physician, it starts out, hey, when was the last time you had a physical? You know, for kids, when was the last time you saw your pediatrician? You should be seeing your pediatrician once a year at the minimum. I mean, that's probably what it is as you get a little bit older. But certainly more frequently when you're younger, in the toddler phase or infant phase. But as an adult physician, come in once a year. Let's get a baseline. Let's make sure you're doing okay. Let's listen to you. And let's make sure you're not dying before you can actually start living. I want to take a moment and give a quick shout out to Midwest Sports Medicine Institute. Midwest Sports Medicine Institute, whether competitive, athlete, or weekend warrior, you expect nothing but the best. Injury or chronic pain in the knee, shoulder, and other joints can be disabling and frustrating. At Midwest Sports Medicine Institute, we strive for excellence in the diagnosis, treatment, and follow-up care for your condition. If you have sustained an injury or are suffering with chronic pain, schedule a consultation with Dr. David Burt to take the first step toward relief and experience the latest advances in orthopedic and sports medicine treatments. Contact the practice today at area code 815-267-8825 or visit www.gomidwestsports.com. So I want to ask Dr. Kraseman this. As an ear, nose, and throat physician and surgeon, what are some of the newer techniques that you guys are doing when you deal with like allergies? You know, sometimes somebody might present to you, they tried maximal medical management and they're still symptomatic. You mentioned about sinuses playing a big role. What are some of the techniques that are out there now from an ear, nose, and throat perspective?
That's a great question. And before launching into that, I did just want to touch on the link between allergy and asthma.
Oh, please go right ahead.
We've been talking about these separately, but I think one of the key facts that most people that don't have a medical background aren't aware of is the fact that untreated or undertreated or unrecognized allergies can predispose people to what we call lower airway problems, meaning asthma. And if one has underlying asthma, then untreated allergies or undertreated allergies can actually make that worse. There's this concept called the unified airway theory. Basically, the airway is everything from the tip of the nose down to the most peripheral part of the lungs. And the thought is, and what a lot of the evidence shows, is that inflammation of the upper airway, so sinus disease, allergies of the upper airway, inflammation of the throat can all lead to inflammation of the lower airway. So if somebody has asthma, which might be mild for instance, and has untreated allergies or an allergy flare-up, it can actually lead to asthma problems. And so identifying or realizing that link is key, and that's a lot of what we do in our practice to point that out and try to screen our patients for who has lower airway disease, meaning asthma, and who has upper airway disease, which we treat, meaning upper airway allergies or nasal allergies. So I generally think of three broad categories in terms of management for upper airway allergies. So for sinus, nasal, throat symptoms, in category one, you can think of medications. There's several different classes and types of that. Category two would be what we generally call environmental control. So avoiding your allergen to the extent that you can. If you're allergic to something, stay away from it, which is far easier said than done. And then the third category is what we broadly call immunotherapy, which most people think of as allergy shots, but which also includes drops that can be administered under the tongue. We do both of those in our practice. The first step to any of that is testing. A lot of people are a little reluctant to undergo allergy testing. They may, be fairly certain, and we may be fairly certain that they're allergic, but proper testing really lends a lot to the management of that disease, because you have to know your enemy. You've got to know exactly what things that you're allergic to what extent, and then you can plan your therapy accordingly. Taking a step back then with those three categories, the first line for most upper airway allergies is oral antihistamines. The prototype is Benadryl. Most people are aware of that, but unfortunately that can make you drowsy. So thankfully some smart scientists came up with a second generation of antihistamines which are non-drowsy. Those include things like Zyrtec, Allegra, Claritin, and then some topical medications like steroid sprays. Most people are aware of those: Flonase, Nasacort, Rhinocort, and all their generic equivalents, which now most of which are over the counter without a prescription. Testing and then in general using those three categories of treatment are kind of how we manage the upper airway stuff.
Excellent. And what do you see? I want to just ask you a follow-up question. Say you do have to kind of look inside the nasal airway or even down the throat. What do you typically see in people that have allergies? What do you see like when you're looking up there with a scope or looking down in the throat with a scope?
So the response of the nasal and sinus lining is pretty characteristic in allergy, and so much so that in medicine we call it an allergic look. So when we're looking in the nose, for instance, typically normal, healthy lining of the nasal passages and sinuses is pink, healthy, glistening with clear discharge, and in allergic folks it will look inflamed, meaning swollen, oftentimes kind of have a purplish kind of almost bruised look to it. Sometimes on the other end of the spectrum it can look kind of white and pale instead of pink, and those are typical findings that we see on examination.
Excellent, thank you. Dr. Baugh, I want to ask you this question. I was reading an article yesterday that I can't remember if it was from Harvard or put it out or Mayo Clinic, but the link between acid and then asthma, and certainly from chronic cough. What do you see? How do you see that in kind of the clinical situation?
Yeah, one of the things I try to look at in patients who are coming in with frequent asthma symptoms or uncontrolled is, are there any, obviously we talked a little bit about, are there allergens that are triggering their asthma? Are they smokers? But also there is a link between acid reflux and uncontrolled asthma. So we try to ask about those symptoms as well, because that could be part of the link that you're missing if you have someone who's coming in with uncontrolled asthma, and then you start asking them, well, do you get reflux symptoms? Are you taking Tums frequently? Are you having a lot of heartburn symptoms? And they tell you yes, and that could be part of the reason why their asthma is not under control. So that's an important thing to ask about in these patients.
Yeah, I think in primary care, sometimes we may overlook that, but it's something that we can all do better. If we know that you can identify something that can be treated right there and then go right at it. The reality sometimes in primary care, there's so many different things that, and I'll take kind of full blame on this, at least I can see this in my practice, but there's so many things you're trying to deal with, because the reality is a lot of people out there have a lot of chronic disease burden, and so when they come and be seen for an evaluation, they're not presenting with just one particular issue. They're not presenting with just kind of asthma or allergy. They're presenting with maybe some GERD. Maybe they're presenting with chest pain. Maybe they're presenting with leg pain. So sometimes in primary care, we're seeing a whole host of different presentations to kind of knock out in one visit, which can be a little overwhelming and certainly can lead to some suboptimal approaches and even some potential gaps that can exacerbate conditions because they may not have been thoroughly addressed, one issue at a time. So we're certainly seeing a lot of it in the primary care setting, but this is where I count on you guys as my colleagues, as if I may not have some time to maybe address all the issues, and I want to have as much time as possible with my patients, but sometimes I have to say, hey, you know what, I know a doctor who really specializes in this. We might not be able to talk about it right now, but I know somebody who can get you in the next week or so and really kind of hit this out of the park. How do you kind of work with Dr. Mora from your end? How do you work with like the doctors, the primary care doctors that are sending you a lot of patients? Do you try to make sure you have a good relationship with them? Do you counsel them? Do you help educate them? Do you see a lot of patients that might just be kind of maybe pushed towards you in the practice?
Sure. I love to go into the offices. That's how when I first opened my practice, I actually went into each of the offices of the surrounding doctors around, brought bagels or cookies and said, do you guys want to hear a little bit about asthma or allergies or food allergy, or let's talk the newest data on food allergy. And that's how they really actually get into a comfort level where they are able to call me and say, hey, I have this patient this little kid who's presenting this way, mom's peanut allergic and she's afraid of presenting the child with peanut. What do you think? What do I do? Etc. So I think one, as specialists for all of us, I think we definitely love to educate the community at large and all primary care physicians. I really love to go do grand rounds. I love to do conferences. I love to go into schools too and teach the teachers, the coaches, everyone, because like you said, it takes a village. So the more people we have educated, the better the outcome for our patients.
Excellent. And essentially you touched on the topic of food allergies, and actually in a few weeks I'm actually going to be doing a countdown to summer series with a couple of chefs on the show 2 weeks from today. So we're going to be talking about food and we might be eating some. But it seems like everybody's saying, oh my gosh, I know I got allergies. I know I have allergies. And maybe we're certainly seeing food allergy cases rise. How are you kind of addressing that issue where you're maybe seeing more people either self-reporting allergies or maybe the fact that they just actually have true allergies? How are you dealing with that kind of a presentation?
Sure. So one is talking about it with them. Basically, when we look at the data, we know that climate change is definitely changing our world in so many ways. We have the hurricanes occurring, like for example, Hurricane Maria in Puerto Rico brought tons of mold, tons of dust particles as well too. So asthma and allergies are on a rise. What's happening in Guatemala, what's happening in Hawaii with all the volcano eruptions, it's a real thing that we're dealing with today. Now we know a lot more as we're learning and uncovering little pieces of the increase in prevalence of food allergy. We know what puts at risk a baby for food allergy. One, if the baby's born via C-section versus vaginal delivery, because they're not exposed to the good vaginal bacteria that mommy has. If mommy gets antibiotics throughout pregnancy, or the baby has trouble at birth where they need antibiotics, wipes out all the good bacteria from their little gut and switches that allergic switch, so increases risk of asthma allergies. If a cat pre-exists the birth of a baby in a home, actually increases risk of asthma, allergies, food allergy. If a dog pre-exists the birth of a baby in a home, it actually decreases risk because of the actual dander. They walk outside, the dogs, and they bring in, so they help in the immunological development of the baby.
Wow, I think it's fascinating. This is some information that I did not know. So I don't know if I need to go get a dog. I think that's what we're saying now. Versus to have the cat. But I think that's just fascinating on those kind of links, and we're seeing that more often. I certainly, I may not be seeing it much because I'm an adult physician, but you're seeing it as early as basically birth, right from the get-go. I think
From the get-go.
Phenomenal.
Oh yes, and now we're pushing towards earlier introduction of foods. We used to say, oh, don't introduce the little child to fish, shellfish, peanuts, or tree nuts till they're 3 years of age so they can tell you if they have symptoms. What did we see when we said that? We saw an increase in food allergy. Because if you think about when we were kids and we were on a school bus, everyone was eating peanut butter, everyone was eating crackers, etc. Now there's the peanut-free table, tree nut-free table, etc. So now we're saying at 3 months of age, if there's no family history of food allergy, start introducing with little peanut powders in the baby formula or in the breast milk as well too, so that way the baby starts getting actual tolerance towards the high allergy foods.
I want to piggyback on what you said. We used to eat things on the bus all the time, and remember when you were kids growing up in school, if it's someone's birthday, everybody's eating some cookies or some cake in the classroom at school. So let me ask this question. Maybe this is a little more philosophical. I'm going to ask this question to Dr. Kraseman. What's the role of school districts in helping, as we're talking about these public health burdens, what's the role of the school district in helping minimize the burden of asthma and or allergy?
Well, that's a great question, and I think that gets to the root of the mission of a school district in general, which is to educate. And that doesn't mean just things that come out of a textbook. That means in all regards. A lot of school systems do a great job with this. They've got health programs integrated, especially in junior high schools and high school. But I think pushing that down to the lower grade levels, elementary school, making the teachers more aware of these health issues. Having said that, I feel that my experience through my own children and their schools is that teachers these days seem a lot more educated than maybe 10, 20 years ago. And again, this is just personal observation in terms of allergy, because the prevalence of allergy and asthma has risen, and statistically we know that. So what's the role of the school system? Education, which may sound oversimplified, but I think the more you're not going to directly drive down rates of these diseases in school, but making people aware of the circumstances that cause these things to arise is the first step in that.
Dr. Baugh, let me actually ask you your thoughts on that question too. Being a lung specialist and seeing asthma, what's the role of the school district from your perspective in helping kind of fight the disease burden?
Well, absolutely. I think just as Dr. Kraseman said, education, making sure that everyone is aware of the different things that need to watch out for, and early education and making people aware of it, I think, is important.
Excellent. I think sometimes the schools, and we know sometimes school funding is a big issue, and so it may be hard to provide those resources to our teachers out there, and certainly to our coaches. And I hope this is where school districts can continue to partner with clinicians such as ourselves, or any other kind of healthcare person that's an advocate for those conditions, to make sure that they have the awareness. And sometimes it takes some volunteer efforts from the medical world to get on it and help out school districts. For example, CPR classes or having an AED device present. But it does take a community to really try to help out if we're going to do this together. At the end of the day, as a parent myself, I want the school districts to help not only educate my kids, but also to safeguard them. If I'm going to have my kids there for 8 hours a day, I want them to be safe and sound, and that's from everything, from not only an educational standpoint, but from a health standpoint as well, too. Let me ask Dr. Mora this question. What's the role of pharma in helping lower the disease burden of asthma and or allergy?
That's a wonderful question, but I've worked closely with pharma as well too. In one, a lot of the schools in the city of Chicago do not have a school nurse every day of the week. They might have her 1 day a week. And their emergency kits don't have an albuterol inhaler and don't have an EpiPen or AviQ. So AviQ and EpiPen, as long as a clinician writes it, actually will supply a free adult AviQ or EpiPen and plus a child one to have as an emergency kit. And I've written a lot of albuterol inhalers. Did you know that flights don't carry antihistamines nor EpiPens nor albuterol inhalers on flight? So we have a lot of work to do in getting these emergency kits really, like they should be part of every emergency kit where, you know, they're still serving peanuts on actual flights. There's lots of asthma exacerbations in schools. There's asthma exacerbations on planes where now cats and dogs are allowed to fly, and a kid or an adult who's truly cat allergic, who wheezes, might get in trouble and they might not be carrying an actual albuterol inhaler. So this is where I think, you know, definitely we need to talk to our congressmen to push and lobby for an emergency kit to keep our adults and kids safe with asthma and allergies.
Yeah, and this goes back to, as we've talked about before, relationships. If we're all going to try to help reduce disease burden, we need to make sure that we have people that are doing well and doing good and having good intentions. It's important that we combine resources, and a lot of it's a public-private partnership. I'm just hearing what you're saying, Dr. Mora, and I'm shocked that, I'm shocked, but I'm not surprised that many school districts don't even have a school nurse there on a daily basis. And it's something that we take for granted, certainly me living out in the suburbs, that doesn't make it equal to those that have no resources. And think about the underserved communities in the inner cities. They should have those resources because, again, we're talking about 14 people a day dying from asthma, which we can all kind of agree that if it's properly managed, you shouldn't be dying. But if we don't have that equity and that access, you know, we're back at square one. We're not moving the needle to solve these problems. Dr. Kraseman, what's your thought? You know, it's interesting. Dr. Mora just mentioned about, you know, lobbying some things at the higher levels of government to do this. What's your role? What's your thought about the role? I said government. What's your role, you think, as far as like whether it's like your local municipalities or even at the state level or even at the federal level? What do you see kind of the role of government in helping to lower this disease burden?
Well, I think the role of government in this setting and frankly in most, if not all, public healthcare issues is collaboration. You know, one side in this equation can't unilaterally solve this. The healthcare sector in and of itself is not going to solve the asthma and allergy problem. Government alone is not going to solve it. Private industry and individuals alone aren't going to solve it. It's got to be true collaboration. So, you know, whether funding for a school nurse every day comes from, you know, part from government, part from private funding, part from industry, you know, there has to be creative solutions to that. And I think that's where the dialogue and collaboration between all of those sectors is key. And, you know, to go back a little to the comments about the school system I was making previously, I think education has to be broadened not just to the students that attend those schools, but also to their families. So government funded or industry funded or privately funded healthcare fairs where family members learn about these diseases and identifying symptoms and management, you know, is key. So involvement and collaboration, I think, is the general theme for all of these.
Excellent. We all can do better, and we all must do better. We've got about 5 minutes left, guys. So I really, what I'd like to do is, as we're going to get ready to wrap up, and this has been just very engaging discussion, I always like to wrap things up by calling this the assessment and plan. We had at the beginning the kind of the chief complaint of the question of the hour, but the assessment and plan, and for those out there that are new to the show or those that have been found the show, the assessment and plan is when somebody comes in and sees us. I got to keep it medical, you know. I got to keep it medical, guys, as a physician. So the assessment and plan is when you've kind of already done your analysis, you've heard the story, the chief complaint, you've done an examination, you've kind of worked on a plan, you have a thought in your mindset, and now you try to implement the plan. You diagnose it, and you implement the plan. So as we kind of wrap up, I want to start with Dr. Baugh. Dr. Baugh, why don't you give me kind of like a couple kind of take-home points for consumers that are out there as far as asthma and allergy? What kind of messages do you have for people?
Yeah, I think it's just the importance of a few things. So one is trying to identify what things might be your triggers, so that, as we mentioned, whether it be pets or environmental exposures, so that they are aware of what those triggers are and trying to avoid it. Early recognition of symptoms and not delaying care. That's where we didn't talk about asthma action plans, but if they start noticing that they're having more symptoms, making sure that they understand when they should be calling their doctor, what medications they should be taking, and being compliant with their medications, and then again, presenting to their doctor early and not waiting until it's too late. That's when patients end up, when they delay presenting to their doctor, they end up in the emergency room, they end up getting hospitalized, and it's so much more serious than at that point. So I think, just recognizing the triggers, recognizing your symptoms, being compliant with medications, and seeing your doctor if anything is different. Those are the important things that I would take away from this.
Excellent. Thank you, Dr. Baugh. Dr. Kraseman, final thoughts?
Yeah, I think in terms of ENT allergy, realizing that it has implications for other health issues, it ties into things like asthma, and isn't just a matter of being uncomfortable with itchy eyes and sneezing a few times, that there are downstream health consequences if those things aren't recognized and treated properly, and knowing what the options are in terms of treatment strategies, and starting with your primary care doctor, such as Dr. Gomez. That's people's best access point into the healthcare system, and our collaboration of specialists with primary care physicians such as yourself is crucial. And so recognizing those symptoms and addressing them properly is kind of the take-home point.
Thank you. Dr. Mora, final thoughts?
So I definitely encourage patients with asthma and who have family members or children with asthma to, one, always have an asthma action plan, two, carry their albuterol or rescue inhaler at all times, in the gym bag, in a purse, and also teach your coach what symptoms or signs to recognize, and tell them it's okay to sit out from a game if they're feeling short of breath or wheezing, to take their rescue inhaler. 3, work with your primary care physician and with us as specialists as well too, to identify your triggers and know that if you previously thought that there was nothing new on the market for asthma, we now are in a new age of asthma. We're phenotyping asthma, allergic, eosinophilic, chronic. So there's a lot of wonderful injectable biologic medications now that are life-changing.
Excellent. And kind of my final thoughts are the following. We talk about, again, the empowerment or the power of having those relationships. Step 1, having that medical exam. But the reality is we have to create urgency. Asthma is real. Allergies are real. A lot of us have been touched by it. You don't feel alone. If you're out there thinking that you might be suffering from these conditions, you're not alone. People have gone through it as well too. But it really takes a community, it takes a village, as we said, to really get better. We want to make sure people have access and they have equity. And when you can do that, you can continue to enjoy your summer, enjoy your families, enjoy your friends, and live happy, healthy, and fulfilling lives. So I want to thank my guests, Dr. Matt Baugh, pulmonologist and critical care specialist at a DuPage Medical Group. He's excellent. I'll see him around sometime. Dr. Stephen Kraseman, board-certified otolaryngologist, expert on allergy as well too with Gerges & Associates. Dr. Kraseman, thank you for coming out today. It's great that we could connect with my fellow Loyola brethren. And Dr. Juanita Mora from the Chicago Allergy Center. Dr. Mora, it's been a pleasure getting to see you again and really to hear your words on inspiration as far as and the passion about allergy and asthma. Of course, I want to thank everybody out there for listening. Thank you for sticking tuned to the program. Next week on the show, we're going to continue our Countdown to Summer series. We're going to be doing part 3, Summertime Skin, Health, and Secrets. Again, my name is Dr. Mark Gomez, Dr. G. You can check me out on Facebook, Twitter, and Instagram at To Your Health, Dr. G. Everybody, take care and peace out. Bye-bye.